right. There we go. Well, good afternoon. We're really happy to be here at Broward Health. I want to thank Shane Strum for hosting us. We're also here joined with our Secretary for the Florida Department of Elder Affairs, Michelle Branham, and I want to thank her for her service. We're joined also by Dr. Maurice Ferre. He's the Chairman and CEO of Insight Tech, and you'll be hearing a little bit about them today. We have Dr. Jonathan Weiss, Chair of the Alzheimer's Disease Advisory Committee. And then we have representatives here locally from South Florida, Lamarco and Fabricio. And we also have from all the way in Pensacola, Representative Michelle Saltzman is here. We also have Tanya Miller, who's an Alzheimer's volunteer and caretaker, and so she's going to say a few things about our announcements today. And so I want to really excited to be here. This is today's announcements have been something we've been working hard on. We are going to sign a bill, but we're also going to make other announcements. I think most people realize that that Alzheimer's is a very destructive illness. It's something that, of course, afflicts the individual who has it, but it also has an enormous impact on family and caretakers, really unlike any other disease that we face. And so we are here in the state of Florida. We're proud to be a state that many people want to be. There's people that work their whole life and aspire to be able to come to Florida and retire. And so with an elderly population, this is something that we've put a lot of emphasis on since I've become governor. And so today we're furthering that commitment to do all we can to help support Alzheimer's research, treatment, and also support care for those who are afflicted by Alzheimer's. And so we have increased funding for all of our Alzheimer's initiatives by more than 60% since I took office in 2019. And if you look, we actually have done more in the 4 budgets that I've signed than was done in the previous 8 budgets before I became governor. And so the commitment, it's not just talk, it's action. We're putting our money where our mouth is, and we're working hard to make a difference. When we first took office, we announced a 5-part dementia action plan that was under the leadership of the Department of Elder Affairs. We have completed that plan. We added Alzheimer's and related dementias as a priority within the State Health Improvement Plan. We also paved the way for additional research and care for those living with Alzheimer's in the state of Florida. We made sure that Florida had a dementia director, becoming one of only 8 states to do so, and we also enhanced our Alzheimer's Disease Advisory Committee. And so today's funding that we highlight really is continuing along that initial plan that we put forward back in 2019. And the funding that we'll have that's in the budget effective July 1st, an additional $12 million for the Alzheimer's Disease Initiative Program. So that's a total of $52.3 million. So that's a significant increase over last year. And then another $9 million for community care for the elderly program, which is total funding at $91.7 million for dependent seniors. Again, another strong increase and a good amount overall. And so we want to help those living with Alzheimer's, but we also would like to play a part in helping with research and treatment so that we can eventually take care of this much better than we've been able to do over these many, many years. And so today we're also pleased to announce, and Michelle will say more about this, the Florida Alzheimer's Center of Excellence. And the role of that is to connect seniors and caregivers with resources and training. And so that also, and you'll hear from Maurice Ferre about this, it includes an innovative partnership with Insight Tech and a consortium of Florida universities for the blood-brain barrier trials that help screen patients to receive this innovative treatment. And they're going to talk about what they're doing along those lines. And this program's got $9.5 million in funding over the last 2 years to help put Florida at the forefront. But this, what they have now at Broward Health, I know Shane will talk about it, Maurice will talk about it, Michelle, this grew out of our trade mission to Israel back in 2019. We were talking about, I saw the mayor, Broward mayor, and you guys have El Al is moving their North American headquarters here. You know, we were meeting with El Al in 2019. We were meeting with all these different businesses. This was one of the businesses that we were meeting with. We brought so many people from our universities. They started to have discussions and said, you know what, we really want to be a leader in this. We want to see clinical trials. We want to move the ball forward so that people with early onset Alzheimer's actually have some hope that there is a way to treat this more effectively than what's been done. And so we're really proud to be here and seeing the fruits of that visit. You also have the, in Broward, they're able to have, they have great programs here, and I know Shane will probably mention some of that stuff, but this is a complex situation when you're caring with somebody that has dementia and Alzheimer's, and there's not a one-size-fits-all approach. And so, you know, I know in Broward they've worked hard to recognize that and to provide support. We're also today at the table next to me, I'm going to be signing SB 806, which creates the Ramping Up Education of Alzheimer's Disease and Dementia for You Act, which is called the READY Act. And the bill will require our health department to educate healthcare practitioners on early detection and diagnosis and reduce the risk of cognitive decline related to Alzheimer's disease and related dementias. Education is one of the best ways that we can detect this disease early and address the symptoms. And so I know Representative Salzman was able to push that for us in the House, and I want to thank her for her hard work. I think it'll make a difference. So I want to thank everybody who's played a part in our efforts thus far and will continue to play a part moving forward. In Florida, you know, we've said in many variety of instances, we want to put our seniors first, and this is another example by making sure that we're putting resources and attention towards something that impacts many, many people, not only throughout our state, but throughout the United States. And so we're going to hear from some of the folks that have been doing a great job, and so we'll hear from the Secretary herself. Michelle, where are you at? Come on, go ahead. Yeah.
Thank you, Broward County, for having me. Thank you, Governor, and thank you, Shane, for hosting us today. For years, I've been called to advocate for our Florida seniors. It's a mission I'm so grateful to do every day as Secretary of Elder Affairs, alongside Governor DeSantis. And I can't think of a greater honor for my life's work and service. And if you know me, you know how hard I've been working to stand here before you today next to our governor on behalf of the over 590,000 Floridians currently living with this disease. Our governor has done more than just passively listen to these voices. He has actively and thoughtfully anticipated their needs and invested in a better tomorrow for their families and all families in Florida. Every single step of the way, our governor has been committed to building an infrastructure, putting seniors first. And that fortified bedrock of resources, programs, and services is especially unique to Florida. The network that we continue to build and strengthen through groundbreaking initiatives like the Florida Alzheimer Center of Excellence, or FACE, and innovative research offered by the Brain State provides real resources and services to those Floridians living with the disease and their families. We've launched a series of collaborative pilot programs under the governor's leadership, including our NAN Cares program, which is right here in Broward County, and dedicated to providing person-centered support for caregivers here in Broward, and technologies such as Project Vital that combat social isolation for seniors and promote mental well-being, as well as EPIC funding championed by Governor DeSantis to senior programs such as the Alzheimer's Disease Initiative, the Community Care for the Elderly, and the Home Care for the Elderly. For over a decade, I've been on journeys with amazing and courageous caregivers and those living with the disease, such as Tanya and Ben Miller, and Tanya's here with us today, and so many other families in Florida. I've been advocating shoulder to shoulder with them as they strive to build a better future than the ones that we face today. For me, there is nothing more selfless than sacrificing for the future of others. The Florida Alzheimer Center of Excellence will build on the current infrastructure of Alzheimer's and dementia resources by connecting the state's memory care disorder clinics, dementia care and cure initiative task forces, the Alzheimer's Disease Advisory Committee, and the Department of Elder Affairs care navigators to create a family-centered support system throughout the continuum of care. while researchers and public-private partnerships forge the most direct path to prevention, treatment, and ultimately a cure for Alzheimer's disease, the creation of the Florida Alzheimer's Center of Excellence helps Florida families now with early detection, early diagnosis, and critical care planning, support, and resources. It also pairs those families with important clinical trials, such as those being offered by the Brain State and the Florida Ed and Ethel Moore Grant Research Program. Next generation innovations paired alongside record-setting funding that Governor DeSantis and the Florida legislature provide every session continues the profound commitment Florida places on putting seniors first in our state. These historic increases in funding continue our state's critical investment for a senior's quality of life, especially as they age at home. From the very first days of knowing Governor DeSantis, I was extremely hopeful for the future of our seniors, especially the most vulnerable. Now, I'm more than just hopeful. I'm mission-bound to bring the governor's consistent commitment to its fullest possibilities here in the state of Florida. Thank you, Governor.
Okay, thank you. Thanks. Well, thanks so much for all your hard work and great job developing the plan, our face, and we're really excited about it. Also proud to have here, hosting us here, Shane Strum. Did a great job for the state of Florida for my first 2 years as governor. I know this is a tough job here, but he worked even harder for the state. And I think he started at 80-hour weeks and then COVID hit. I think he did 90 to 100. So we really appreciate all he did for us and for the people of Florida. And we thank him for working hard to improve health care down here in South Florida.
All right. Good afternoon. How is everyone? All right. It's tough, right? Following the governor and the secretary is never easy. Passionate. And talking about work, I did work a lot. He worked even more because if the governor was in the office, we had to be in the office. So if anyone thinks we were there because we wanted to be there, we were there always working hard. But this hardest working governor in America. But we couldn't be more excited about having Governor DeSantis with us today. And this, you heard the secretary. She's unbelievably passionate about Alzheimer's. And you know what? Because of what you heard the governor say a little bit ago about his trip to Israel, a trade mission that actually has borne fruit for us. It's truly amazing that the partnerships that have grown from this. But $500 million in research, this technology being built, created, and driven in Israel is now being deployed here. And this is the first place it's going to have it. So it's going to be a really unbelievable collaboration between Inside Tech, the University of Florida, and Broward Health. I'd be remiss if I didn't thank our good friend Maury Husseini, the former chairman for the Board of Governors and the current chairman for the University of Florida's Board of Trustees. Maury, thank you for being here. These partnerships don't work unless everybody buys in, but what a great collaboration, right? The governor has made sure that there's funding for a state like Florida for Alzheimer's research, and behind me, the secretary will carry this out. The representative has worked incredibly hard to make sure there's additional legislation for all. I want to thank our Board of Commissioners. They're phenomenal. They're the ones that allow us to enter into these partnerships and agreements, and we couldn't do it without you. In the past year, our health system has celebrated a number of successes and found innovative ways to bring the most advanced health care to this community here in Broward County. Today, we are really going to explore something new. You see this equipment off to the side. I talked about the investment in time and money, but at ground zero is here. You'll hear a little more from Dr. Ferrer right here, which is pretty amazing. Physician, but entrepreneur, and also Dr. Shane Moskowitz. He's got a lot of titles, right? He's triple board certified, MD, PhD, heads up our neuro research, but he'll be here working day and night to make sure that these clinical trials are successful for our residents. Right, Broward County has over 2 million people and one of the larger senior citizens. You couldn't have picked a better epicenter for this research to be conducted. So we're going to bring more hope to this generation. There hasn't been a lot of success in this area, but Dr. Ferrer tells us there's much on the horizon. We're going to explore new boundaries in medical innovation to create new best practices in the care for Alzheimer's patients, and all of them. And this is only possible due to the tremendous leadership of the governor and many of the state leaders that are here who saw the need in our state and sought out those solutions and helped with the financing. Governor DeSantis, your support in bringing this clinical trial to the residents of Broward County is great for the state of Florida, for Broward Health, and everybody else. Thank you. This is just another example, and I think this is a phenomenal example of how the state's universities, the safety net hospitals like Broward Health, can be global leaders in medical innovation while simultaneously creating greater access to the highest quality of health care for all. So Broward Health, in this great partnership with the University of Health, University of Florida's Health, is proud to be really its first designated site here in the state of Florida. So this groundbreaking Alzheimer's research and trials will begin here. A lot of the questions are, when will it begin? Immediately. They're looking for the folks now. So I'll wrap up with, in summary, really, this is a true instance of medical technology marrying academic medicine to really work with the finest community and the folks in this area. Together, Broward Health, UF Health, and Insight Tech are aligning our strengths and resources to create a program unparalleled worldwide in the hopes of finding new options for the treatment of Alzheimer's. Again, I want to thank the governor. I want to thank our Board of Commissioners. I want to thank the representative. Anyone's all their time. Mayor, thank you for being here. Dr. Foray, Chairman Maury Husseini of the University of Oak. What a great guy helping us make this happen, but all of you for being here. Governor, thank you.
Thank you. All right. Okay, here to talk a little bit more about, from the company perspective, Dr. Maurice Foray from Insight Tech.
Thank you, Governor. And first and foremost, I think this is really a momentous day. I think it couldn't have been said more eloquently from the past speakers that spoke about this, but it's really a marriage of coming together with a remarkable piece of technology. And here we have the technology. This is $500 million to develop. And happy to say here in the state of Florida, we've got the Brain State program and this initiative, and we're excited to kick this off. On behalf of everyone from Insight Tech, I'd like to acknowledge and thank the Honorable Governor DeSantis, the Florida Legislature, Secretary Branham, Chairman Weiss, the CEO of Broward Health, Shane Strum. Of course, Shane, without Shane, this would not have happened. Shane is a force of nature, and I think we all who know him know how tenacious he is in those 100-hour weeks. I really think that, Shane, thank you so much for doing that. And also, without the teams, the physicians that are here, the folks from the University of Florida, and all of today's speakers and esteemed guests. The urgency to meaningfully accelerate the pace of medical innovation in this area is very clear. The CDC currently estimates that as many as 5.8 million people in the United States are living with Alzheimer's disease and related dementias. And according to the State Department of Elder Affairs, Florida has the second highest incidence of Alzheimer's in the country, with 580,000 estimated patients over the age of 65. And I'm sure everybody in this room has a personal story of somebody with Alzheimer's and know how debilitating that disease is. And there have been so many attempts of trying to fix this. It's one of these areas, if you're a researcher, it's very painful because in your life you have not seen a cure. And we have to keep on fighting for this, because if we don't, not only are we going to impact so many lives, the dollars associated with this disease are astronomical. By the year 2050, it's estimated that the cost of Alzheimer's is going to be $1 trillion. So we truly are on a mission to really find a cure for this. And the work to more rapidly advance research in this space can lead to meaningful improvements in the length and quality of life of thousands of individuals and their families. And I can't re-emphasize more the importance of family, because it's not only impacting that individual, it's impacting their families. And that's why we're so passionate about doing this, and particularly passionate about doing it in Florida, because Florida really means a lot to a lot of us that have been born and raised here, and know what a great state this is, and what the governor is now doing to make this even a greater state. Improving the lives of patients is core to our mission at Insight Tech. I know that mission is shared by many others in this room today. Many thanks must also be included to the Board of Governors of the State University System of Florida for its commitment to this work. The board has closely partnered with Insight Tech and the state's academic leadership to bring this vision to life. Thanks to their support, we are working collaboratively with an outstanding group of universities and medical center partners, including the University of Florida, Broward Health, FIU, Baptist Health, Florida Atlantic University, and Delray Medical Center. As a foundation for this Alzheimer's initiative, Insight Tech has made private investments for placing our Exablate system, the neurosystem, focused ultrasound platform, as institutions across Florida at no charge. The investment will allow researchers across Florida to access our innovative, non-invasive surgical technology. This is first of its kind. I don't know of any other company that has done this on a state level, of being able to work with the Board of Governors and put these type of technology in the hands for researchers, where we're not taking a dime. What we're doing is that's going straight to the universities, and the universities are doing their research under strict protocols. First developed in Israel and now approved for use in many countries across the world for treatment of conditions like essential tremor and movement disorders related to Parkinson's disease. This is in addition to significant clinical investigating already underway in several other areas, including Alzheimer's, which we're excited about. Research across Florida will leverage the capabilities of the Exablate neural platform to temporarily disrupt the blood-brain barrier with sound waves, helping these researchers explore potential new generation solutions for people with Alzheimer's disease, as well as other neurological conditions such as brain cancer. We at Insight Tech are highly optimistic about the potential of this public-private model. There is a tremendous power in convening academia, government, and healthcare sectors, and private industry as partners dedicated to uncovering new discoveries in healthcare diagnostics and treatments. And we have to think creatively here, because what we've been doing in the past just isn't working. So bringing in this type of model, I think, is one of the most important things that can help solve this problem. To the shared tables, Insight Tech brings its own unique contributions: advanced medical research and technology, state-of-the-art systems, hands-on experience in harnessing the power of acoustic energy, support the processes around the FDA review and requirements, and much, much more. The entire team at Insight Tech is honored and humbled to support such a bold vision led by Governor DeSantis, and I am confident that together we will meaningfully advance the landscape for patients both now and into the future. Thank you very much.
Okay, now we'll hear from Tanya Miller, Alzheimer's volunteer and caretaker.
I want to start by thanking Governor DeSantis and Secretary Branham for their continued support of those living with Alzheimer's and other memory disorders. I'm incredibly thankful for the opportunity to be here today as an advocate for the 580,000 Floridians living with Alzheimer's disease and related dementias. I am also here as a daughter whose mother was diagnosed 7 years ago at the age of 65 with Alzheimer's. She was a young, vibrant, and very capable woman who has been stripped of her independence and so much more along this difficult journey. I am fortunate that my mom is able to live at home, but she requires round-the-clock 24/7 care. And most recently, my father-in-law was diagnosed with dementia and is currently at a memory care skilled nursing facility. My loved ones cannot speak for themselves or perform activities of daily living on their own. They need someone by their sides at all times. This was very scary for them and for the rest of my family. Funding for Alzheimer's patients and caregivers means that families like mine will have the ability to give their loved ones the best possible care while managing this disease. These resources keep families together and empower them to keep loved ones at home during their journey. Funding Alzheimer's research provides the opportunity to improve treatments, plans, and quality of life, and one day, a cure. I am thankful to live in a state to lead the nation, that I am thankful to live in a state working to lead the nation in Alzheimer's care and research, and for leaders like Governor DeSantis and Secretary Branham, who fight for the voiceless.
Thank you. Good job. All right, I'm going to make this bill official. So, getting down to the wire. They passed a lot of bills this session. Takes a long time to go through them, so we're getting there.
You're the guy. Go
Today is the 23rd. Okay. There we go.
All right.
Yes, of course. Anyone else? Where's he at?
Give it to these
There
guys.
you go. Who else? Okay, got that.
The doctor.
Two more.
The doctor. Give it
You
to the
got
doctor.
it?
Get one from us. There you go,
Okay.
doctor.
All right, anyone? All right, there we go.
Good thing.
All right, good stuff, guys. Thank you. All righty, takes a question. You know, I mean, like this, it's, and I'm trying to think, like, what is this obsession with 24? Like, we don't even have the 22 election. I think it's because the media knows that the Democrats are going to get hammered in 2022. They don't want to talk about it. But it's just funny. It's like, you know, in a sure sign, he's plotting a political future. Governor DeSantis has taken his kids to get ice cream or something like that. I mean, it's just ridiculous. So, no, we're not only, I mean, obviously we have the 2022 election, which we do work on, but I mean, you know, we're spending so much time actually advancing the ball substantively for the state of Florida. I mean, we just did a major initiatives through the budget. I did record budget vetoes, record surplus, huge initiatives in education, environment, obviously healthcare. So we're really proud of it, and we work awfully hard at doing it. And as I mentioned, we are coming into a landing with all the legislation. I mean, they did a lot of bills. I think they did more this year than my other three, it seems like, because I'm going through these. So we're going to finish all that, you know, by July 1st, and so that'll be good. And so all the decisions will be made on the most recent. Yeah. Hi.
I'd like to stay on topic.
I'll tell you what, I'll do. Is there anyone that wants to ask about Alzheimer? Okay. Yep. Okay.
So, your Family First budget, or Florida First
Yep.
budget covers a lot of funding for this and other medical issues, including veteran funding. Make a lot of Democrats, maybe one or two Republican legislators vote against your budget.
Well, I mean, look, I think people can be held accountable for the choices that they made. I mean, if you look at what we did in the budget, we did more tax relief than we've ever done in the history of the state of Florida. If you look at what we did in the budget, we did more for conservation, Everglades restoration, and water quality than we've ever done in the state of Florida. And if you look at what we've done in education, biggest increase in teacher compensation in the history of the state of Florida. We did an $800 million categorical just for teacher compensation. That's the floor. That you could obviously do more because we had other stuff, but we've also married that with good policy. We've got great policy on environment. We've got great policy on education choice. We've done a lot to make sure our school system should teach kids to learn and educate them, but not indoctrinate them. And so we just won, you know, they sued us on the Stop Woke Act, and the judge dismissed it in Tallahassee. And so all across the board, you know, we've been able to do a lot, and the policy has been strong. The budget, I think, has reflected that. Look, when they spent a little bit too much money, I took out the veto pen. I mean, because, look, at the end of the day, Florida has had just a boom with tax revenue because you look at these hotels, restaurants, all this stuff. We're the #1, in the last year and a half, the #1 tourist destination in the United States by far, and one of the biggest, if not the biggest in the world. I mean, there's people all in other countries that are talking about Florida, particularly South Florida, about wanting to move here or visit here. And so the result has been we exceeded expectations on all the fiscal. And so I looked at it and said, okay, there has been inflation, there's been increased population, that requires infrastructure, all these other things. You know, we actually are gaining students in our school system. A lot of the other states are losing because they lock the kids out of school. So a lot of the parents said, the heck with this, and they've either moved states or they've done homeschooling, whatever. And we support homeschooling in Florida 100% and all parent choice. But it's interesting that we've had really a boom when so many other states have had big declines. And so those are just things we had to deal with. But I felt they went a little too far. Before I was governor, the record for line item vetoes was about $800 million. We did $1 billion 2 years ago in line item vetoes. I did $1.5 billion last year. This year we did $3.1 billion in line item vetoes to make sure the state is fiscally responsible. Yes. What's that? So in terms of, I haven't been able to read the decision today, but from what I've seen, I think it was a great decision by Justice Thomas. Very rarely does he do anything that is not correct. I mean, I think he's been a fantastic justice. And so, you know, in Florida, I think the debate has really been on not necessarily open carry as much as what they call constitutional carry, which in different states have done that different way, whether it's concealed or not. But I think the issue is what you don't want is to have a government bureaucrat stymie your ability to exercise your constitutional rights. And I think that's been the concern that people have had. So I'm going to look, I think it was definitely the right decision. I think you have some of those states like New York, they just do not want people to be able to exercise their rights. And here's what I would tell you, a lot of the people moving here from there are doing it because they don't feel safe in a lot of those communities. So all their policies have been a total failure when it comes to public safety. And I know they want to go after a lot of law-abiding citizens and their rights, but they let criminals out of jail. They don't prosecute people the way they need to be prosecuting people. And you see it there. You saw it in San Francisco. It got so bad they actually recalled the district attorney. You know, but it's interesting how ideological this is, because the communities in San Francisco that voted to keep him in place were the more affluent communities that are somewhat immune from some of this. All the working class communities wanted him out because they're bearing the brunt of those really bad policies. Comment on Andrew Gillum. Do you feel vindicated? Because in 2018, you called him out for being under investigation. You were called a liar and a racist. Do you feel vindicated today, sir? Well, you know, what I would ask is, you know, I would ask a lot of the media that propped him up whether they have any type of mea culpa on that. I mean, there were clearly a lot of issues there. If you looked under the hood, you saw it. But what was presented to the public was that this guy was like the second coming. I mean, never has a candidate been elevated, I think, that way by media outlets, certainly in the last 10 years or so. And I can tell you, if I had not won in 2018, this state would be in a much worse shape, and that's not even a question. And so we're happy that we were able to do it, but even more happy that we've been able to lead and accomplish more than anyone thought we could accomplish in the state of Florida. Yes, ma'am.
Would you consider coming to Century Village?
Okay.
All these seniors who would like to hear what you have accomplished.
Oh, good.
You are accomplishing for them every single day.
Yeah.
We really love you.
Oh, thank you, you know. You know, it's interesting because when you remember, you know, when COVID hit, obviously the elderly, you know, you looked at the data, it was not taking out kids like it was elderly. Now, some things like Spanish flu really hit the kids hard, so we saw it there. And so what we did early on, you know, we worked to protect nursing homes. You know, we'd send National Guard to help test seniors. We did, when the vaxes came out, CDC said you should do it based on political considerations and socio-racial considerations for priority. I said, no, I'm doing seniors first. And that's the way it's going to be. So we buck CDC, and eventually everyone had to follow Florida because it was the right thing to do. But we were able to bring them to these senior communities. I know we were at Kings Point over in Delray Beach. They did the Century Villages. They did a bunch of those. And our thing was, it's available. It's not mandatory. You can make whatever decision you want on that. But we worked hard to make it. And then when we saw that people were still getting infected, we did the monoclonal antibodies. And we gave that to 175,000 mostly elderly people. And that unquestionably, saved the lives of a lot of people. And so we're very, really what we're doing today is just a continuation, really, of our view to just keep seniors first. I mean, we've have a responsibility to our elders, particularly in the state of Florida. And I think you've seen that across the ways and different things that we've been able to do. And that includes bucking the establishment. When they wanted seniors to be really in the back of the line, we made sure that they were at the front of the line, and on it goes. And so we appreciate a lot of the folks in these communities. And just the way this stuff works out, with the Alzheimer's, you go any of our elderly communities, there's going to be people there that are going to develop this, unfortunately. That's just the reality of it. And so this is, I think it gives some people some hope. We would love to be on the foreground of this. And yes, financial, as Marie said, is huge. I mean, it will have an economic impact on our society if the trends continue without any meaningful relief. And then also just the fact that people are losing their way, and it's a sad way to end your life. And then all the other people that are affected. I mean, it's just incredible the amount of effort that people go through, but then just, it gnaws at them inside because they lose touch, with people, and they don't remember and all this, and it's really, really difficult. And so if we can make an impact on that, man, I mean, we've made an impact on a lot of things we're very, very proud of, but this would really, I think, have a huge impact on this state. And so I want to thank everyone for being a part of it, and we will work hard to do everything we can to help our senior citizens. Okay, guys, thank you. We'll see ya.